I'm Dr. Nikita Shah. I'm an obesity medicine doctor and the founder of Weight Sense like Nona, where I help people lose weight, gain health, and transform into their best selves using science-based medicine and personalized obesity treatment. Today, I have Dr. Pauley on the show. She's a board-certified pediatric endocrinologist and the founder of The Endocrine Crow, a direct care clinic in Orlando, Florida. Dr. Pauley is a wonderful physician, entrepreneur, athlete, wife, and mom. She wears many hats, and I'm so excited that she's here today. Dr. Penny, welcome, and please introduce yourself.
Thank you so much for having me, Dr. Shah. I was so excited when you invited me. I love this topic, and I think it's going to be a fun discussion. So I'm also local to Orlando. I'm a pediatric endocrinologist, mom of two, workout junkie, and lifestyle lover.
That's awesome. So today I wanted to talk to you about a point where both of our professions intersect, and that's obesity. Obesity is a medical condition that affects 40% of the adult population and about 16% of the pediatric population, so roughly like 1 in 6 children. When I work with patients, if they themselves are parents, one of the main drivers they seek me out for is that the parents want to improve their health so that they can be here for their kids, run around with them, play with them, and be active. But another reason parents are interested in this work is also because they want to help guide their own children along on the healthy living journey as well. So this really brought to mind like the topic of like building family goals and helping both parents and children as a family unit just transform their health together. And I thought this is really great because instead of one person thinking about it as like, I'm doing this for myself and not engaging with the family, I think this topic really helps kind of bring it in to where everybody can participate and improve their well-being in the household. And I think that's really powerful and beautiful. So tell me a little bit about your thoughts of like how a person can start to build goals as a family and really improve the well-being of their family.
Yeah, I mean, I always like to try to make it fun. So I guess the first thing will be, what is going to be because we all have so many different goals, right? So it's always a good idea to try to work on one goal at a time. I like to ask patients, like, what would you like to work on first, right? Is it going to be less screening time? Is it going to be incorporating more vegetables? Or maybe more physical activity? And so we just kind of like tackle one at a time. And the main thing with kids is it has to be fun. You know, we have to try to make it fun. Otherwise, it's not going to be super successful. And also, like, they are always watching. I speak for experience. They're always watching. Like when I work out in the mornings, if there's for whatever reason a morning when I'm not doing it, my kids ask me like, hey, mom, why you didn't exercise this morning? You know, like they hold me accountable. And with time, they have incorporated that too. So they very frequently join in. So they're watching, they're mimicking. We are our best role models for our children. So let's say that the family wants to work on incorporating more physical activity. Then what do you guys like to do? Do you like to go riding your bicycle? So maybe we can do that a weekly thing. We go to our favorite park and we just do a few laps. Or if maybe walking and jogging or running is what they prefer. A fun thing that I read is that maybe you sign up for a 5K every month. And then take a picture at the finish line with your family. And at the end of the year, you can put all those 12 pictures of your family run after the run or after the walk. It doesn't have to be a run. Just as your prize, your trophy. Look at this. We have done this. We did it as a family, and it's great. It's a great way to start.
I really love that. So the other thing that I often tell people is we're in Florida, so the beach, and like we're in Central Florida, so the beach is really close by, but there's also lots of hiking trails and even like the parks. Like a lot of people have annual park memberships. It's like if we're going outside and walking, if we're doing something together, it builds that connection as a family. It also just makes it more active and fun. Other things are like taking the ball around, playing basketball, playing soccer, but just not worrying about like doing it right, but just getting out and doing it.
Doing it. Yeah.
And dancing. So my dancing and I love bike riding. Actually, one of the things about accountability is I try to help my kids know my own personal like activity goals, and so I do it based on minutes. And then they'll say, "Mommy, did you get your minutes yet?" They're like, "No, I'm lacking on my minutes." They're like, "Okay, well, we got to go ride a bike now because you got to get your minutes." And they are just always championing me to like get those minutes in throughout the day. So it's really good.
We also have in our neighborhood, we walk as a neighborhood, like, so we have a few families that we just like meet every Monday evening around 5 p.m. We meet at around the, like the square of the town, and we have a little walk, and then we always finish at the playground. And so that's like the price for the kids is like, if we do the walk at the end, you get to play for a good 30 minutes, and then we walk all the way back. So it's like, we walk, they play, we walk back, everybody's happy, and ready to go to bed, quite honestly.
And it's a great way to tire them out. That's what I was going to say. That physical activity, actually, like that physical activity for the children will help with their, like, improve sleep for themselves, and ideally give you some quiet time as a parent as well if they're going to sleep earlier and on time. Sometimes people have struggles with screen time. So some of the barriers, like getting outside, is a child may really just be wanting to be on their tablets or computer or playing games. And because especially coming out of COVID, I think a lot of the things that we were doing outside of the home have diminished, and now we're getting back into it. But what are some strategies to get parents and families to limit the screens?
Well, and these can actually incorporate both, like working on screen time, but also doing something together and something healthier. It's, for instance, doing maybe like following a cooking recipe, like how to make a dish, like a healthy dish. It could be like a salad or something in those lines. And so if the kids are we're doing something together, we are watching this, we're having some screen time, but it's because of something fun and nutritious. I mean, that kind of like hits a few boxes.
I love that. So when like we're bringing up cooking, so that's one way I try to get my own children to get more involved in the kitchen and also start feeding themselves good food. So do you have any tips on like how to start? Like, I have some picky eaters, but how to kind of switch that topic of like picky eating and then kind of getting more fruits and vegetables on the plate for everybody?
Yes. So we always at home, we talk a lot about the rainbow, right? Rainbow colors. Mine's are I think my kids are a little younger than yours, so they're 5 and 7. So we still are, a lot of rainbows and things like that in our day-to-day conversations. So we try to have different colors in our plate and see how close we can get to the rainbow. So we definitely get a lot of the orange and the reds and the greens and the yellows. And so we're trying to like hit as many colors. And I kind of like to make it a competition and see who can get closer to the rainbow, to all the colors of the rainbow.
Yeah, that is so wonderful. I love that.
Yeah. And also like my kids actually are kind of picky, but I have to make it, like I said, just fun when they're not into it. Because I'll be honest, Dr. Shah, a lot of times they don't want to get into the competition. Then I have to compromise and say, hey, you know what? At least one vegetable needs to be in your plate. And typically it's going to be carrots. That's the winner in my household. But hey, I'll take it.
So something that I'll tell parents as well is when we're doing family meal time, I don't want to make meals really difficult for the family, especially at dinner time when you've had a long day at work and you're getting home and, one child has like XYZ preferences, another family member has another set of preferences. So something that I'll incorporate is really like when you're meal planning together, get the children involved. Like start thinking about what are you going to have throughout the week, ask them questions of like what they like, and really get creative about how you can put that food on the dinner table in a way that's quick, easy, and that the children and the family unit really enjoys. So a lot of my meals in my home turn into like family bar. Really, we just lay everything on the middle. So if it's, taco night, we have all the ingredients, all the vegetables, all the things to make your tacos, but everybody gets to make theirs the way they like to do it. Then I'll tend to like reuse a lot of those vegetables and so forth for the next night. And maybe that night it's pasta. And perhaps for me, I may not have the noodles, maybe I'll have zoodles, but then the children can have the noodles. So I try to make it easy for myself, but then also really I want to feed my kids. So I'll bring it in, like what do they like to eat? And that's how I'll set up the week of like asking them, like, what do you want for breakfast? What do you want for lunch? What do you want for dinner? And then how can we make this like one step healthier?
I love it.
So is there, in terms of pediatric obesity and weight, because that is one of your specialties, can you tell me just how somebody, if they find that their child needs more one-on-one support from a doctor, like how they can find you and some of the things that you work on medically in your practice?
Yes. So one of the things, and I'm sure you have touched upon this before, that concern us a lot about obesity is the consequences of obesity, all the metabolic complications that we see, blood pressure, cholesterol, and diabetes. Diabetes, I am seeing patients with diabetes as young as 8 years old, which is quite scary. But the good news is that we can work on that. We don't have to wait until we get there to do something about it. There are some risk factors that we certainly can change, like your genetics, right? If a parent lives with type 2 diabetes, that chances for that child is going to be much higher than if there's no family history, ethnic groups, so African Americans, Hispanics. So there's nothing we can do about those two things, but lifestyle. And so as early as 8 years old, when they come with that concern, if they have risk factors, I like to be talking a lot more about lifestyle, exercise, drinking more water, less screen time, and all of that. And I start screening them. Recommendation usually is around the age of 10, but because I have patients that are 8 years old and already have crossed that line, I start earlier to screen them for diabetes.
What does screening for diabetes include? Like how do you know when to screen somebody and when to screen them?
Yeah, so if they are 10 years old, the recommendation is if they're 10 years old and they have at least one risk factor, so either family history, ethnic group at risk, you can start there. Again, I start a little earlier just because of my experience. But yeah, so we will recommend to get a fasting blood sugar. So a fasting blood sugar is the first thing in the morning blood sugar after a night of fasting. And that level needs to be under 100 to be considered normal. If it's between 100 and 125, it's considered impaired, meaning it's abnormal, but not quite at the level of diabetes. And if it is greater than 126, then that's concerning for diabetes. We typically repeat that level, either with oral glucose tolerance test, or we may get a random blood sugar that if it's over 200 and already has the symptoms of excess urination, excess thirst, and weight loss, actually, because a lot of times they can have weight loss after having weight gain. That will be confirmation. I know in adults, we use A1C for diagnosing purposes. In kids, we use mainly the fasting and 2-hour stimulated sugar. A1C, we use it mainly for monitoring, but not so much for diagnosing.
And when the children, if they're younger than 10, or actually in the pediatric population in general, I know when I take my kids to the pediatrician, I'm always looking at the growth chart. Is there anything particular that a parent should pay attention to when they're looking at the growth chart, when they maybe think like, hey, maybe we should be screening for this, I need to bring it up to my doctor?
Yeah, so the average growth of a child should be approximately 2 inches a year. That's a normal growth of a child that is not in puberty. Actually, I should specify, not in puberty, 2 inches a year. If in puberty, it's more like 3 to 4 inches a year of growth, but the amount of weight should be roughly about 5 pounds per year. So if your child is gaining more than 5 pounds a year, definitely is concerning. We need to regroup and see where where is this weight coming from? A lot of times it's lifestyle, and that's why we're talking about things here, obesity, diabetes, and all that. But a lot of times it can be just another subset of conditions like a thyroid dysfunction and so forth. So that's why I said we should regroup and try to identify where is the weight coming from.
Awesome. Okay, so in summary, if there is a child in the family with a risk factor for a condition like diabetes, after the age of 10, we should be screening for diabetes in that group. Starting at, and I think there's sometimes like a little bit of parent intuition, so that's why I'm going to share this piece. But if starting at 8, 9, or 10, there is concern that maybe that there's something going on with the child more than what meets the eye. So say there's weight gain of more than 5 pounds in a year, or maybe some weight loss, increased thirst, increased urination, then perhaps going to the doctor and discussing this and maybe concern for diabetes would be appropriate. So, and then Dr. Pauley, you're in Orlando. Where can people find you?
I am in the Ocoee area, so around the pocket of the west side town. And people can find me on social media at The Endocrine Co. Same with Facebook, and my website is www.endocrineco.com.
Awesome. Do you have any other thing you want to share with us?
I guess my finishing points will be just to remind you that, and all our followers, that we need to continue to be positive role models, making good choices for ourselves day in and day out, because our kids are always watching, always listening, and we want them to try to model what we're showing.
I love that, and I couldn't agree more. Thank you so much.
Thank you for having me.